everyone. Welcome back to the Dental Tourism Albania podcast. Today we have a very special guest. We are here with Dr. Irma Marku. The reason why this is a special guest is because Dr. Irma is not just any doctor in Albania. She's actually one of my closest friends, right? And she's been around from the beginning of dental tourism in Albania. She supported, advised, and criticized me as well, but she's been teaching and helping me a lot to understand a patient's journey at the dentist. And it's actually a real pleasure to have her here today with us, and we'll ask her some questions to learn more about her and how she has arrived to where she is now. Let's introduce Dr. Irma. Hey, Irma.
Hello. It's very nice to be here. Thank you for having me.
Thank you. Obviously, it's a real pleasure to have you here, and now as to a certain point as a colleague, not just a friend anymore, and a personal family dentist as well. So at this precise moment, I'm not afraid of you.
Just for once.
Just for once. Irma, obviously, I know quite a bit about you, and I would like everyone else to get to know you a little bit more. I'm sure all the new patients will love to meet you. You are one of the experienced and upcoming doctors and clinics in Tirana, investing quite a lot in the dental tourism space. So I want to know a bit more about how did you become a doctor? What was the drive? What was the push?
Well, you make me go back in time, a long time ago, actually. Well, my dream was always to become a doctor.
Mm-hmm.
Actually, a pediatrician, yes. But because of the very long time studying, almost 6 years, long period, and then different specializations, I thought it would be quite a long time to start a career and to start a family at the same time.
You really wanted to go to work.
Yes, I wanted to work, but my passion for, let's say, for medicine, to serving patients, was the same. So maybe it was best something that had a lot of relation in the medicine area, but something more specific. So that's why I chose dentistry.
You've done very good, and I'm happy you've done so.
I'm happy as well. I love dentistry. I love practicing, actually, because as we were talking
earlier,
yes, nobody will tell you I became a dentist because I loved fixing other people's teeth. But you learn step by step. If you have compassion and you want to serve and to treat patients, it's something that you end up loving doing.
And of course, on top of that, an eye for beauty as well, because I know you're very detail-oriented.
Yes,
And I've seen that in practice. So what would you describe yourself as? What are you a specialist in? Obviously, even within dentistry, there's different areas that you can specialize in.
Yes, of course. It's a long time. I've been practicing dentistry, almost 20 years now. So
you can't tell.
I have done almost everything, treating from kids to adults, and there are various problems, oral problems, dental health problems. I specialize in prosthetics and in periodontology, but recent years I've been practicing a lot in implantology as well, because you have to come along and to treat patients' needs. So you see,
as the needs grow, then you obviously want to improve.
As patients' needs grow, you need to serve them the best you can. And actually, I would love to do everything. So, and I'm very, as you mentioned, detail-oriented, and it has been very difficult for me to leverage. So my patients, most of them are with me since they were little kids. So I know everything about their dental health, and it's very difficult for me to deliver them to another patient to another doctor, even if it's my colleague working at my dental practice and my own dental studio.
So you want to make sure you see them
I
all.
want to make sure I have everything under control. It's not always the best thing to do, but I want to check on everything.
So the next step of medicines, we just need to multiply you. Dr. Irma, speaking about treating children, I know you've had the opportunity to look after my kids as well, and is it? They're quite young, and I've seen firsthand how well you've managed and supported them. And my 4-year-old, he's quite happy to come back and see you, to my surprise.
He's a great kid, actually.
And my 7-year-old, a little bit less, because of, he's had to do a bit bigger treatments, but they're actually, beside the jokes, always excited and never feel the big fear of going to the doctor. And you've been very patient with them. Less with me, but more with them in this case. So really thank you for that. Again, it's fair to say that this podcast today will have a lot of personal interactions. It's because Dr. Irma has been in our family for quite some time, and we always kind of revert back to her for everything that we need. Even on a late weekend night, I'm in pain, what do I do? Or when we go out for dinner, like, oh, yes, Irma, I think my tooth is hurting, can you check? Always happening. I know that you've invested a lot of time in implantology recently, and I want to check, who are your patients that come to do implants in your clinic? Are they local patients or are they international patients? What would you say?
Well, for quite a few long, they have always been local patients, or my patients who I have treated, and their families as well. They live abroad. They have suggested their foreign friends or family, because now with a lot of Albanians living abroad, a lot of marriages with foreign people. So they have suggested me all of these friends. Gradually, yes, a lot of foreign patients have joined.
Albania.
Yes, Albania, and they love coming in Albania. They love visiting different places, and that's why dental tourism is always a very good idea, I think. And it started like this. More people referring more people, and then recently, a few years from now, I've been treating foreign patients, not only, never neglecting the local ones, of course.
But you've had more international patients come into your clinic. Okay. I know you're multilingual, which helps. So you speak Albanian, English,
a little bit of French, Spanish,
Italian.
Italian, yes.
Yeah, all the dentists in Albania speak Italian.
Everybody, I think, not only dentists. We were grown up watching Italian TV programs, so it was a little bit of our
second language. So patients coming from different parts of the world find the comfort of, easy communicating with you in one language or another.
Except from the language, I think human beings and people can communicate through body language and through energy. So when patients feel they are welcomed, when they feel that you have the best intentions to treat them, they immediately feel comfortable and they feel at home, and everything really goes smoothly. Even though sometimes they have to do big procedures which take time, they have different steps to finish, but we have always had very good relationship with patients. I think Albanian people are very welcoming people, so not only the doctors, but everywhere they feel
it's cultural.
Yeah, they feel welcomed, and when you ask them, they always would love to return to Albania.
This is good. Definitely very good. Can I ask an example about a long procedure? So maybe a full mouth restoration, or I don't know, all on 6, all on 8 implants, procedures that normally take a few hours to complete. How do you keep the patient calm? And
Well, first of all, as I said, it's since the beginning, and the what you transmit to them, how you explain to them the treatment, and all the steps that they have and we have to take together. So they are prepared. We do long conversations and very detailed explanations of all the procedures we are going to have, how long they are going to we expect they are going to last, and the patients feel comfortable, they are prepared. We have never had any patients, any issues with that.
I need to get out now. So it's managing the expectation and preparing the patient.
I think we need to prepare them. They need to know what is going to happen. Some of them are anxious, I have to say that, but it's the preparation and the before the treatment work that we do with them, and then the dental treatment.
It's very difficult to decide what you need. So I often come to realize that sometimes people think they need an implant or possibly a crown or maybe nothing or a bridge. What is the best way to explain to the person who's come to your clinic to say, I've decided I want an implant, but probably that's not the best decision for them. But they've set their minds up, so I really want it because, you know, this is what I think is best for me. What is the process and the steps you take to?
Yeah, well, actually, it is true, and there are different treatments that can solve the patient's problems, dental problems, dental health issues, and there are a lot of solutions sometimes. We at our clinic, we always explain all of these procedures, all of the options, what they can do, and then we come with our suggestion. And we also explain why this suggestion is the best for us, and we are always biologically oriented. So we want to do the best for our patients. We want to personalize the treatment to the point they accept what's best for them. And most of the times they accept, but there are also some patients or the young generation, I would say, which often require treatments that are very aggressive treatments, that they would become dental patients for all their lives, and they have made up their mind they want to do the procedure. Most of the time, I manage to do what's best for them.
Persuade them the alternative.
Persuade the alternative, the best biological alternative, because we have to be aware that once we do a treatment, once we touch our teeth, there is no going back. So the treatment has to be perfect, and even if the treatment is perfect, all these treatments last 20 years, let's say, or even more sometimes. But if you start the treatment at a very young age, at a certain point in life, it's
20 years comes very soon.
Yeah, so I know that perfectly.
Okay. What would you consider a difficult patient?
Well, as I said, I always try to know my patients and to prepare them and to explain them, and I have never had difficult patients. Let's say the patients that it took me a little bit longer to persuade them to do the treatment, but I wouldn't define them difficult patients.
Okay. If I was to ask your patients about you, what do you think they'll say?
Well, I think you have to ask them.
I have asked myself.
I can say that I try to do my best for the patients, so to personalize the treatment for them. That's the best I can do. I think I transmit them calm, tranquility, and give them assurance that we will do the best for them.
So do they often come back to you and say, Dr. Irma, how can you stay so calm and how are you so softly spoken?
No, not really, but I can feel it.
you know that it's working, right? How long have you had your clinic, Dr. Irma?
It's almost 17 years.
So Dental Oasis has been running for 17 years.
17 years.
And how did you choose the name?
Well, as we were just talking, I am very oriented towards reassuring people they are in good hands. They will be treated in a very delicate way, let's say, and I wanted them to feel as if they are in vacation, as if they are in an oasis.
Yeah.
So, because when you think of the dentist, most of people are scared and they immediately start to think what is going to happen to them. So by naming my clinic Dental Oasis, I wanted the starting point of an environment which you can feel calm and best served.
So, to start the prep early.
Yeah.
Dr. Irma, it was a real pleasure to have you here today. I'm sure we'll have you back in our future podcast to talk about different areas of different treatments that you offer at your clinic. But today it was more about giving the opportunity to our audience to get to know you a little bit more, and maybe they'll come back with questions in the future, and we'll have a very more interactive. But before you go, I always have a little tradition in the end of the podcast where we kind of go through a few myths about dentists and treatments. So, would you say that the dentists go to sleep counting teeth instead of sheep?
Well, I think
has it ever happened to you?
Sometimes.
Yeah.
I would say, yeah.
So you're thinking about.
We always need to think about what's best. I always like to make my treatment plans in the evening or in the afternoon when I'm calm, when I don't have other patients waiting at the office.
Yeah.
So I think clearly, and I'm prepared to give them the best option for them.
Okay. The mysterious blue light is actually a mind control to make us floss more.
Well,
if it works.
I don't know if it works, but I wish it could.
Dental x-rays can see also our souls.
Well, obviously a myth, but the dentist appointment may be something they can get into it at a certain level.
Right, perfect. Thank you so much again. Lovely to have you here.
It's been very nice being here with you.
Thank you. Thank you to everyone for listening. Once again, follow for the links with Sirena at the end of the podcast. See you. Bye-bye.
Thank you everyone for joining us on today's podcast. Stay tuned for more and don't forget to follow us on our socials.